Welcome to another edition of Disability and You. I'm Ganesh Singh, your host. On this program, I am joined by Mr. Keon Chung, who is the coordinator of the Regional Special Education Needs and Disability Diagnostic and Treatment Center, which is located in the Sir Potter College of Education compound in Turkine on the east coast of Demerara. Mr. Chung will share with you the operations of the center, what services are available, and how persons or members of the public can access those services. Mr. Chung, welcome to the program.
Thank you much.
Excellent. So tell us about the Regional Special Education Needs Disability Diagnostic and Treatment Center.
Thank you very
What
much.
is the center all about?
The center basically is there to provide a comprehensive evaluation for persons. The assessment process, because it's a process, should inform one, legislation and instruction. The assessment process begins with an in-depth interview done by a social worker. And then the social worker would relate this information to the other specialists in the building, which would be speech therapists, physiotherapists, occupational therapists, psychology, psychopedagogy, stimulation. And each specialist listens to the information of the individual against the backdrop of their individual speciality. At that level, further referrals are made if the person needs to be referred out for something else, or if the person needs to have more information collected, and or we identify which instrument we're going to use based on what is presented. It's important for that process because if the individual is coming from a remote area of Guyana, where English perhaps is not their first language because they speak the native language, and we use a particular instrument for those who an instrument that is culturally responsive. And if someone also has a speech impairment or a communication disorder, there's also a particular instrument that is used for that. So that particular aspect of the assessment process is very, very important. Once we've identified what instrument we're going to use and we've answered the questions, basically the questions would be like, how is this individual hindered academically? Then we move on to the assessment process.
So you mentioned persons, Mr. Chung. Just elaborate a bit more. Who are the persons? Who can access the service?
Well, the center basically is set up to address the needs of children, youth, and adolescents with special education needs associated with disabilities. We have gone above that in that we've had some adults who would have walked in and they said they've had these issues for a while now and they want to know what is the issue about, and so we would have extended the services to them as well. Persons can access the center via the school setting if they're coming through the school setting. And this would be a referral system from the schools.
And when you mention schools, public or private schools, or all?
Combination.
Combination
Public
of both.
schools, private schools, special schools. So we have the school system one, we have the health sector, and this comes either the hospital or the health centers. We have walk-ins, like I just told you, the older ones that would have done that. And then we would have had those coming from NGOs who would have referred a couple of them also.
Is it only persons with developmental disabilities can access the services, or do you provide assessments for other types of disabilities?
Well, according to IDEA, Individual with a Disability Education Act, there are 13 categories of disabilities. So it's not only cognitive impairment, and when we talk about cognitive, we're talking about the learning process and procedures there. So we do intellectual disability, learning disability, specific learning disability, that is. There is traumatic brain injury, there is developmental delay, and to mention a few.
And then the whole host of learning disabilities,
Correct.
or the whole spectrum of that. Mr. Chung, how long the center has been in existence?
The operation started in 2018.
So prior to 2018, where were persons accessing these kinds of assessments? Was it done privately, overseas, or how was it done?
Prior to 2018, I know the Special Education Needs Unit at NSERD would have been doing some preliminary assessments there. And the assessments done at NSERD would have been along the lines of identifying if the child has a challenge and perhaps supporting the teachers in identifying how they can best support them.
But with this center now, it's you would say it's more comprehensive.
Yes, what you get is a diagnosis. You know exactly what the challenge is, and there's an intervention plan there. In some cases where the variables are too many, there's a stimulation period. And this one particularly lends itself to those who are referred to the center for being suspected of being on the autism spectrum, because that one can be a bit of a tricky one. Because individuals can display signs of autism, but it's not necessarily autism. So the stimulation department comes in here in that the individual is placed in the department for a period of time, minimum 8 weeks, and we use evidence-based teaching practices to really ascertain if it is autism that we're looking at, and if it's not autism, then what it is and what we can do to support that individual going forward.
So you spoke earlier of diagnostic and treatment. The treatment aspect, how long, is there a duration or a specific time frame that you guys work within to provide treatment for any person that might access the facility?
No, the treatment programs basically vary on the severity of the effect of the individual. So some of it can be as short as 3 months, and some of it can go for beyond the 3 months based on the issue.
All of the treatment, is it done at the center or is it done in partnership with probably the schools that the child must be attending?
At this point in time, it's a combined effort, in the sense of the speech therapy is not done at the center, nor is the assessment done at this point in time because of the limited number of speech therapists in Guyana. Some of the stimulation is done in the classroom. It's taken to the classroom, so we go to the schools and we work with the teachers, helping them to understand what it is they can do to support this individual, and it's monitored. And some of it is being done at the center.
So, what you would have mentioned there, it seems to be a lot of work. What's your staff complement like? How many persons do you have on staff?
Right now, in the area of technical staff, there are about 5 of us.
5 persons doing all of this?
Correct.
Interesting. Persons who are, let's say, persons who are living in Region 1, Region 9, those far-flung areas, even in Region 6, do you find many of them accessing the services, or what systems are in place to take the service to them, if any?
Yes, they do access the services. And what we have at the center is that we have a cycle, basically, whereby we try to go to the regions where we have numbers, where persons have been sharing their numbers with us and their concerns, and we go to those areas and we provide the services there.
So, Keon, you've mentioned working in partnership with the schools, the special schools and so on. Are there many children that you guys would have provided services to in the mainstream schools? Is there any integration done?
I'm not sure I understand the question.
No, you would have mentioned working with children who are in the special education in schools. Do you have many children that you've worked with that are in the mainstream schools?
Yes. Right now, I can say the numbers at the center, we have more mainstream students accessing services with center than special ed schools. One reason for that could be in that some regions we don't have special schools, so these individuals are in the mainstream setting. So yes, we do work with those in the mainstream as well.
So do you provide guidance to the mainstream teachers in order to help them teach the children that are in the
mainstream? Correct. And we are going to be shortly working with the mainstream teachers in the individual education plan.
Keon, all of this, and it's a service provided by government.
Yes, correct.
Which one of the ministry or the ministries is?
At this point, it's a combination of the Ministry of Health and Education, and yes, Health and Education at this point in time.
Okay.
Human Services has also, Ministry of Human Services have also played a role in it.
And that's the social work aspect of it, providing
correct
some level of welfare assistance. The name, Special Education Needs Disability Diagnostic and Treatment Center. Is it something that is supposed to serve persons across the Caribbean region? And how, if that is so, how you've been able to do that?
Initially, what we have now initially came to Guyana as a project, and a project that would have come as a result of a CARICOM Heads of Government Summit, where the initiative was to have the region, the Caribbean region, CARICOM member states, have a unified position as it relates to identifying, treating, and preventing disabilities in the region. Our regional scope or reach at this point in time is not on a wide scale. We have had persons from some of the sister or brother CARICOM countries reaching out for accessing some of the services. And yes, we have been working with them where we can.
Excellent. And I assume most of that is virtual.
Correct.
Keon, you mentioned all the work that you guys have been doing, which is much needed, and I'm sure would have made a difference in the lives of many persons living with disabilities in Guyana, because they can now know what is happening and what they can do moving forward. What are some of the major challenges in performing the work of the center and really providing a service to the society or to the nation?
I'll take the latter first in terms of providing service to the nation. I think the regional center is a fantastic initiative. It can, like I said earlier, the assessment process serves to inform legislation and instruction. It will inform legislation in the sense that when we do the assessment, we have a diagnosis. There's an eligibility aspect of it. The eligibility aspect of it basically says what this individual needs in order to function. Now, if we were to culminate that on a regional scale in terms of the different administrative regions of Guyana,
yes,
and then we were to look at it at a national scale, we'd see exactly what it is we're looking at nationally. Let's take, for instance, Region 10. Hypothetically, we haven't done it just yet, we have assessed 400 persons. You're going to have 50 of them needing spectacles, 75 of them needing hearing aids, 120 of them needing assistive devices, 300 of them needing speech therapy, 400. And when you put that in all the regions, it gives you an idea as to what it is that you need to support them. So on a national level, it really can complement the work of the National Commission on Disabilities, the Ministry of Education, Health, Human Services, and really help in terms of propelling the work and improving the quality of life of persons with disabilities in Guyana.
So you would have mentioned what you envision can be done using the data that you guys would have gathered, the
Correct.
information. Is that being done?
To some extent, yes. Like I said, we have been working with the Ministry of Human Services in that information, we just had a cash grant, or we still have it ongoing for persons with disabilities, children more so. And the numbers, we have been able to help them to understand those who have disabilities. And when I talk about disability, I mean the laws of Guyana clearly articulates what is a disability, 3605.
Definitely.
And what is helpful to understand is that not all disabilities are disabling. So we need to differentiate those two there.
And not all disabilities are visible.
That is correct. And the hidden ones are the ones that we are really helpful in terms of helping the National Commission on Disability to identify and to be able to help provide services.
So you have an ongoing relationship with the National Commission on Disability to provide diagnosis for persons with hidden disabilities.
That is
for the registration.
correct.
Excellent. So what are some of the other challenges in delivering your service to the wider society?
I think at this point in time, the only other challenge we have is staffing. Yes, we are understaffed. And
Well, yes, five technical persons with a national mandate.
Yes, and perhaps having more offices set up in different regions to help with some of the groundwork, and then to ease the challenges of us having to decrease the time cycle, because the time cycle can be a bit of a lengthy one when you've got all these different regions. So if you were to visit Region 1 now, then it would take a while before you get back to Region 1, whereby if you had some persons on the ground, a small team there, it may be able to
at least work
cushion
with
the
a treatment
impact.
plan.
Yes, correct.
Work with a treatment plan. Are there any plans to help with the staffing issues? Are there any short-term plans you have, whether it's providing training or seek external assistance to get more technical persons on board?
Well, I think it's fair to say that the Ministry of Education is exploring both options, looking internally and looking externally to see what services we can get to provide support in terms of the center. Other plans would be currently the Ministry of Education is building a sensory room there, so we'll have the first sensory room in Guyana. In addition to that, we will be, via donation, having a pool built there, so we'll be offering aquatic therapy to children, particularly with disabilities in schools.
Excellent, excellent. So it's not just going to be swimming lessons, but
No,
an actual
aquatic
plan.
therapy. Yes, aquatic therapy, yes.
And that is something. Only this morning I was having a discussion with a parent, and they mentioned how essential is swimming or aquatic therapy for their child's development. So I'm really happy to hear that. Keon, what are some of your partners that you would have worked with to ensure that the programs that you implement are, let's say, well executed and it's on par with what is international standards? Or do you have those partners?
Yes, we do. We have our local partners. We're partnering with the various ministries, health and human services so far. We partner with UNICEF, we partner with some of the NGOs, the National Commission on Disability. Yes.
Because why I ask the question is that the field that you're working with, it's always evolving.
That's
Things
correct.
are changing. And the assessment tools that you guys use, what are those assessment tools?
Okay, well, I think I would have mentioned earlier the different specialists we have, so there are different departments. The psychology department, which is the lead department, we have gold standard instruments, the Woodcock Johnson, the WISC 5. We have the Universal Nonverbal Intelligence Scale, like I was mentioning to you, for those who are culturally responsive instruments. We have the Ravens, we have the Brigands. For persons who have intellectual disabilities, because they may not function or cope with a cognitive test, so we do the scales of independent behavior, which basically looks at the adaptive and maladaptive behaviors. We have, for persons who have behavioral issues, there is the ASIBA or the Achenbach, and it's a behavioral checklist and the behavioral checklist, it's based on the age of the individual. It's a three-prong approach in that the parent fills out one and the teacher fills out one. If the individual is of age, the individual fills out one also. The purpose of that is to be able to triangulate the information to see if it's the same thing we're getting all the way through from all of them.
Interesting.
We also have the Wyatt Dyslexic Index Screening. Now, with that one, I think people are of the view that once you do this dyslexic index screening and it says you have the probability of being dyslexic, that you automatically have dyslexia, and that is not the case. What that means, if you complete the assessment and you screened in the probability of having dyslexia, is that an intervention is put in place. An intervention is put in place because we want to be certain that the challenges that the individual is facing is not due to a lack of adequate instruction or environmental factors. So we're going to give the individual about 3 months' time with an intense intervention program, and then we bring the individual back to reassess the individual. If the individual still shows the same signs, well, then we can say, yes, this individual is dyslexic. But should the individual show any improvement along the line, well, then we perhaps extend the intervention phase to see what more is needed or to rethink how it was done, and then we still go back with it there. The occupational therapy department has their own OT assessment, and in addition to the Brigands, because the Brigands is very comprehensive. The speech therapy, there's a Peabody, there's a preschool language scale, there's an articulation test they use there. Yes, to mention a few.
How often do you have staff development sessions? Because as we would have already established, these assessment tools or instruments that are used, they always evolve. They change every few years. So how often do you have staff development to ensure that your technical personnel, they're up to date with what are the current trends and what is happening globally? And do you get the people from these various institutions that produce these assessment tools to provide some level of instructions to your staff?
Our staff development sessions they happen regularly. They happen quarterly. But what we have weekly is check-in, and the check-in is that I'll take you back to the assessment process because
Yes.
we have the interview and then we have the individual assessment plan or the IAP. In this planning session is whereby all the members sit there and we talk about what this issue is with this individual here. At that point in time, we identify the instruments and we justify the use for the instrument. In this rich discussion, we really get to tease out the different areas here, and by now, I can see without fear or favor that the team is quite capable and competent of using those instruments. In terms of reaching out to other people, like with the Achenbach, when they would have reviewed it, we would have been able to have a relationship with them in terms of revising how it is being used and administered. In terms of the WIAT or the WISC, we partner with the LDS, Jesus Christ of Latter-day Saints, who would have brought the first set of instruments for us, and then we would have continued with the Ministry of Education, would have procured those. And we have the superintendent there in the US who provides virtual training for us as it relates to using those instruments.
So it's safe to say, and the general public can be assured, that whatever is done is being done on par with international trends.
Absolutely, absolutely. I mean, we've had individuals coming to us from, there's the University of Miami there, where persons go to have screening for autism, and while they would have showed that they're perhaps on the spectrum, they would have referred them for a comprehensive evaluation, and that would be something happening at the regional center here in Guyana.
So let me clarify, you're having the University of Miami referring persons to your center?
Well, no, they're not referring persons to our center, but what they're saying is that the individual needs a more comprehensive assessment, because when they go there, they just go for a couple of days or a couple of weeks, which is not enough time to give them that. So at the center where you have this comprehensive evaluation, persons can access that kind of information.
Excellent. So persons that probably they're not part of the education system, or they just need an assessment done. Is there a cost attached, or everything is absolutely free?
Absolutely free.
Absolutely free.
Yes.
Keon, you got would have mentioned 5 technical personnel, more members of staff, with a whole lot of work, a significant mandate. What is the waiting time like? I'm sure people would like to know.
Well, that is the challenge. Yes, the waiting time is, or can be at this point in time, a pretty lengthy one. If I may say, at this point in time, we've closed off interviews for 2022 to see if we can address the backlog that we have there. So anybody we will take your information now. Please do not misunderstand me. But the interview, as of now, will not be done until January of 2023 to deal with the backlog that we have there.
Wow.
So that gives you an idea as to some of the waiting time.
Definitely.
From the time of the interview to the time of the actual assessment should be about 2 weeks, and it should be a month after the assessment before the report is actually produced.
Do you get many referrals from pediatricians working in the private sector, the private health sector?
I'm not sure how to quantify many, but I can say that we do get referrals.
You do have that relationship. Keon, if anyone would like to benefit from the service or get in contact with the center, how can they do so?
At this point, you can dial the number. It's 222-2018. Unfortunately, I can't remember the WhatsApp number.
That is fine. And working hours? If they want to walk in?
Between the working hours, yes.
Within normal working hours?
Correct.
Could you give some more detailed directions to the center? It's in the CPC compound.
Yes, using the 4th Street entrance there by the Turkey Nursery School. Once you're on the Teachers College campus, you make a left by the Benab and down to the back, the pink flat building.
Excellent. So, Mr. Chung, I want to thank you very much for sharing with the general public on the services available at the Regional Special Education Needs, Disability, Diagnostic and Treatment Center, and the benefits of accessing those services.
Thank you for having me.
Thank you very much for being with me for another edition of Disability in You. Do join me next time. Stay safe, Guyana.